Red Young, and this is Chiro Bites, little bites of information that might help you out. One question I do get asked every so often is, does my baby need to get adjusted? Or how do I know if my infant needs to get adjusted? There's a few things that I go off of. Usually if a baby is colicky, they're crying a lot, babies can't tell you that they've got neck pain. They can't tell you if they have a headache. They can't tell you if you got mid-back pain or low back pain. They just cry. So if you have a very fussy baby and a colicky baby, sometimes I find that they respond very, very well to chiropractic care. Another thing that you can look at is if your baby is fussy while they're laying face down or face up. They don't do well on their back and they squirm and they cry in those positions. That usually means that there's something locked up and it doesn't feel good to them. Nursing. If the mother's nursing, she knows the baby's head isn't turning well, or they get fussy with latching on in one direction versus another direction, then usually there's a problem with the neck. Pooping, that's a weird topic, but pooping, babies, if they're nursing, they should be pooping a lot, at least a couple, 2-3 times a day. And if a baby isn't pooping, I've had some infants not poop for 3 or 4 days, and their doctors say that that's normal. You try and go for 3 or 4 days without pooping, see how you feel. Usually there's something locked up, and you get their low back and their lumbar area adjusted, and they start pooping better. So look at the frequency of pooping, especially if they were pooping good and then they're not pooping. Then that shows you that something's shifted. Other things, sometimes babies don't sleep well. I had one that was sleeping for an hour, and that's all the baby was sleeping, and constantly wanted to be held. The baby wasn't fussy, but sleeping was a big issue. And that little boy was really quite messed up in his back. And I was surprised he didn't have some of the other problems. But we adjusted him, and he started sleeping longer, spitting up, usually with more than normal spitting up. And sometimes when you notice that a baby is sitting there and all of a sudden it'll just cough up, and it wasn't after they've been burped or anything like that, it just kind of happens. Usually they respond really well to chiropractic care. So just some real quick ideas on what to look for in a baby and whether or not they need to be adjusted. The things that you want to look for with adjustments with a chiropractor is when you call around, ask if they adjust children. You can even discuss how they adjust children. There's different ways to adjust babies. You can use electronic adjusters like I have here. I know a lot of them that you'll use a handheld adjusting device and get movement into their spines through that. I like using my fingers and pressure and working the joint into place. There are different ways to do it. You just want to feel comfortable as a parent in seeing how your child is being adjusted. So it doesn't hurt to call the doc and ask how you do that. Maybe demonstrate how they do it. Just so that you feel comfortable in doing it. But that's what you want to ask if they do adjust infants, maybe how long they've been adjusting infants. I love adjusting babies. They're just great patients. So hopefully this helps you out. But babies, yes, can be adjusted. The youngest I've adjusted is a 4-day-old. So they can be adjusted very quickly after birth, especially if there's problems. So hope that helps you out, and I will talk to you later.